For years, Ugandans, the National Drug Authority, together with officials from the Ministry of Health, have complained about fake drugs on the market, wondering how possible it is for them to enter into the country. The illegal drug laundering has left several pharmacies and medical outlets closed and their proprietors arrested, with the general public developing several complications. As a way of reducing the number of imported fake drugs, the government has unveiled its plans of having all medical delivery systems digitized. According to Dr. Grace Ajulong, the Assistant Commissioner Health Services in charge of pharmaceutical supply chain and logistics, Ugandans have for a long time been decrying fake medicines on the market, resulting in damages of their health and death.
We have what we call GS1, the global standards, international standards, for monitoring the commodities right from the manufacturer to the user. So it will help us to note all those kind of things that you are bringing out about the fake commodities. It will tell us once the commodity is noted that it's fake, it cannot get into the country once we effect the use of the global the GS1 standards. That one is going to be solved.
Martha also said there is a government plan to establish a pharmaceutical industrial park in order to allow the production of pharmaceutical products within the country rather than importing them from foreign countries. According to Martha, almost 80% of the medicine used in Uganda comes from outside countries like China, India and other countries, and she says this park will reduce the cost of importation.
Government has secured land for the pharmaceutical industrial park to support the establishment of local manufacturing facilities, together with availability of cheap labor, electricity, other government incentives which will be provided by these industries, which is conducive for the environment for local manufacturing. We therefore call the foreign exhibitors to work towards investing the local manufacturing here in Uganda.
However, commenting on the loopholes existing between the prices charged by wholesalers and retailers, Dr. Martha said there is need to make a study since the government does not regulate prices. She also explained plans of regulating herbal medicines in the country.
Uganda does not regulate prices. So that is what we need to do first, studies for us to regulate these prices. Because we have the public and then the private sector. For us, the government gives medicines free of charge. Those are procured from national medical stores and taken to the facilities. Now when we come to the private sector, that is where the challenge is. So we cannot just come in and say, let us have this price for each commodity. We are yet to reach there.
Dr. Martha made the remarks during a press briefing about the upcoming third edition of Uganda's largest pharma, medical and healthcare international exhibition slated for 22nd and 24th February at Uma Showground, Lugogo. She said the exhibition will help people to get information on new technology used in other countries, hence improving the quality of health.
We are particularly happy to note that Uganda and the Ministry of Health are together with the Pharmaceutical Society of Uganda and partners with Exhibition Trade Service of India are holding the third Pharmaceutical and Healthcare International Expo, where over 1,000 of the exhibitors are from several countries, namely Uganda, India, United Arab Emirates.
Several other stakeholders and partners expounded more about the planned exhibition and expected benefits.
The event is the premium focused international expo in its sector in Uganda. Uganda Pharma Healthcare has the support from all the major stakeholders in this sector in Uganda. It is jointly organized by Pharmaceutical Society of Uganda and ETSIPL and is officially supported by the Ministry of Health, Allied Health Professionals Council.
Who have orthopedic problems can come. They will reach out to members of our team who will be stationed there. We'll listen to their problems, and where possible, we will offer them the necessary advice.
In this exhibition, we are going to be standing in for the patients, because Uganda Medical Association, actually we are here on behalf of the health workers, but also on behalf of the patients.
John Baptista Humuza, Church of Uganda Family TV News at 8.